Hi, my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon with a special focus on gender affirmation surgery. And in this video, I'm going to be talking about a strategy which does work well for some trans feminine patients. And I see a lot of patients in my practice follow this strategy in order to make their transition as smooth as possible. And so, as you guys know, in the United States in this day and age, transitioning is expensive business. A lot of folks don't have access to benefits through their insurance, and for those of you who do, we're seeing these days that a lot of insurance companies have high deductibles, meaning that every year before your insurance kicks in, you may have to pay $10,000 or even more. And so for that reason, a lot of my patients will plan very carefully how to do their surgeries and in what order to do them in order to minimize. It's always worth mentioning that surgery, of course, is not for everybody, and not everybody will need all of these surgeries. For some folks, hormones are enough, not even hormones, and it doesn't make you any more or less trans whether you do surgical or medical transition, so just to mention that. However, what I would say commonly we see in our practice is for patients who want to undergo bottom surgery, and so I mean here folks who do vaginoplasty or zero depth. Typically in my practice that's going to be a two-stage procedure, meaning two different surgeries. A lot of patients have to travel for those procedures, so oftentimes what patients will do is they will plan to do vaginoplasty as their first procedure, and so this is going to be the most involved, the most expensive surgery. Typically it's about 6 weeks of work recovering from this and learning how to dilate and use your new anatomy. And so oftentimes with that surgery, we're going to want to do the second part of it, but wait about 6 months. So a lot of my patients will plan to do their vaginoplasty as early in the year as possible if they're on that calendar year for their deductible. And so they'll do their vaginoplasty. At the very earliest, we'll do the labioplasty about 6 months later. And with the labioplasty, it's an umbrella term, and it just means we're doing whatever we need to do in order to make the anatomy as pretty and as functional as possible. Now, typically I won't do top surgery at the same time as vaginoplasty because it just becomes too much surgery, and when you do too much surgery the complication rates rise. So for that reason I'll just do vaginoplasty. However, labioplasty typically looks like maybe a 1 to 2 hour procedure. It's an outpatient procedure, meaning the patient leaves afterwards, and oftentimes that's when we can combine a breast augmentation or top surgery and do that at the same time. So therefore, rather than undergoing 3 separate procedures, a lot of patients will opt to do that so that they only do 2, and this obviously helps save in cost. That's just one possible strategy. Other things we see are folks who are not at a place in their life where they are able to do full bottom surgery, but maybe it's in their future, and they will combine, let's say, top surgery with an orchiectomy or just removal of the testicles. That's a nice one because we're able to take the patients off the testosterone blockers after that, and usually the dose of hormones needed to get your estrogen levels where they need to be are a lot lower. So it's always worth thinking. Talk to your surgeon, talk to their staff about ways you can strategize in order to make the system work for you a little bit better. I mean, it's hard to make the system work for you, but a little bit better if you do strategize. I hope this is helpful.